Hello, everyone. Thank you for the opportunity to share our results on abundance of bacteria and histopathologic findings in the small intestine of dogs with chronic inflammatory enteropathies. So for the purpose of this presentation, when I refer to chronic inflammatory enteropathy, I'm referring to dogs with persistent gastrointestinal signs that last for longer than 3 weeks, where specific causes for gastrointestinal signs have been excluded, such as infectious organisms, as well as parasites, and histopathologic evidence of gastrointestinal inflammation. So we know that most of these patients with chronic enteropathies, they are going to respond to a dietary trial with a novel protein diet or hydrolyzed diet. And these correspond to 2/3 of the patients, approximately. Some of them are going to require immunosuppressant therapy, and these can include steroids as well as cyclosporine to control the clinical signs. And a minority of them are going to be responsive to antibiotics such as metronidazole and tylosine. And few patients are going to have frequent relapse or are not going to respond to any of these treatments, and they are classified as non-responsive enteropathy. So the pathogenesis of chronic inflammatory enteropathy is believed to be caused by an interplay between the environment, host factors, and genetics, as well as the intestinal microbiota. We know that based on recent studies that there is no evidence of bacterial overgrowth in the small intestine of dogs with antibiotic-responsive enteropathy, and neither a specific pathogen has been identified. But still, historically, veterinarians have been using empirical antimicrobial therapy to treat dogs with chronic intestinal inflammation. And this is done in an attempt to possibly removing some pathogenic bacteria or suppress commensal bacteria that might be triggering the immune system. As you know, recently there are increasing concerns about the consequences of antimicrobials. We know that they are not harmless. As we thought, they can lead to diarrhea in healthy dogs. They can result in prolonged intestinal dysbiosis as well as antimicrobial resistance. Histopathology historically has not been very helpful in predicting the treatment in response in chronic enteropathy, other than confirming inflammation and excluding neoplasia and infectious organisms. A previous study has looked at the numbers of CD3 lymphocytes and other lesions in the lamina propria of the duodenum in dogs with different categories of chronic enteropathy. This was done before the WSAVA standardization, and they have not found significant differences. There were other studies that looked at the histopathologic findings in dogs with food responsive and steroid responsive and not found significant differences as well. So the objectives of this study was to characterize the histopathologic findings in the duodenum and ileum of dogs with different categories of chronic enteropathy, and to quantify the bacteria in the small intestinal mucosa using fluorescence in situ hybridization. So fish has been used before in the ileum and large intestine, but there were no previous studies using fluorescence in situ hybridization in the duodenum. So for this study, it was a retrospective study using tissues from 53 dogs with chronic enteropathy from 3 institutions, including Texas A&M, University of Helsinki, and the Endovet group in Italy. So 23 dogs were classified as antibiotic responsive, 13 as food responsive, and 18 as immunosuppressant responsive. And then we also used duodenum and ileum from endoscopic biopsies from dogs, healthy control, from a previous study that was not related to this current study. None of the dogs have received antimicrobials or immunosuppressant drugs 1 month prior to the biopsies. For histopathologic evaluation, this was done by a single pathologist that was blinded to the group. And the slides that were evaluated were stained with hematoxin eosine and scanned. and graded following the WSAVA scoring criteria. So both duodenal and ileal samples were evaluated. Not all of the dogs had matching samples for both duodenal and ileal. So for bacteria quantification, we utilize fluorescence in situ hybridization. So this is a technique that uses probes. In this case, we use a universal bacterial probe that targets all the bacteria in the sample. That's called EUB338. And you can see in red the label bacteria on the surface. In green corresponds to the intestinal epithelium, and blue are the nuclei of the cells. So for quantification, we separated in 3 different categories, including total bacteria in the sample, attached bacteria that you can see on the image on the right, that red dot that's closely opposed to the intestinal epithelium, so that was considered attached bacteria, and bacteria that were present in the lamina propria were considered invasive. So these slides were image, and bacteria were quantified using ImageJ for his statistical analysis. So for the results, the canine inflammatory bowel disease activity index was evaluated and compared between groups. And here you can see that, as you expect, because these dogs had clinical signs, all the chronic enteropathy had increased CIBD scores, but the clinical activity score did not differ between the different chronic enteropathy groups. Regarding the summative histopathologic scores, so this is when we add the different features, scores for neutrophilic inflammation, lymphoplasmacytic inflammation, lacteal dilation, etc. When we look at in the duodenum, all the groups of chronic enteropathy had higher summative WSAVA scores in the duodenum when compared to healthy dogs. But in the ileum, only dogs with antibiotic-responsive and immunosuppressive responsive had higher scores than healthy control dogs. It was not significantly difference between food-responsive and healthy controls. So when we evaluated the frequency of neutrophilic inflammation in the lamina propria, in the ileum, you can see that dogs with immunosuppressant responsive enteropathy were more likely to have neutrophilic inflammation in the lamina propria than dogs with antibiotic responsive enteropathy. And this is what we consider a surprising finding that we are not expecting. Next, and epithelial injury scores and fibrosis scores were also more frequent in dogs with immunosuppressant responsive enteropathy. And this shows that probably the inflammatory infiltrate here is secondary to the erosion of the epithelium and other mucosal damage that was happening. When we look at eosinophils, those polymorphonucleated cells with pink cytoplasm, they were more frequent in the duodenum of dogs with food-responsive enteropathy and immunosuppressant responsive enteropathy when compared to healthy controls. And then there was also a positive correlation between the histopathologic scores and the clinical disease activity score. So this has been shown also in previous studies. So for both the duodenum and ileum, this was observed, and this means that in cases with more severe histopathologic features, we also saw more severe clinical disease. When you look at bacteria abundance, there was no difference in bacteria in the duodenum between groups or compared to healthy control dogs. This is considering the total bacteria in the sample. In the ileum, dogs with antibiotic-responsive enteropathy had a higher number of total bacteria in the mucosa when compared to healthy control dogs. But here I want to point out that there was significant overlap between the different chronic enteropathy groups that could not be differentiated. Similarly for attached bacteria, so no difference between groups in the duodenum. In the ileum, there were more bacteria in the antibiotic-responsive group and compared to healthy dogs. But again, there was a significant overlap between the three chronic enteropathy groups. Regarding invasive bacteria in the lamina propria, very few dogs had invasive bacteria in the lamina propria, and there was no significant difference between the groups. So this was mostly observed in dogs where there was erosion or ulceration of the mucosa, and those are more likely commensal bacteria. So when a clinician sees a report of neutrophilic inflammation in the intestine, this can lead clinicians to use antibiotics in this patient. And according to the results from our study, this is not appropriate. As you know, often we associate neutrophilic inflammation with bacterial infection, but it's important to have in mind that there are other triggers for neutrophilic inflammation, including damage or dying cells, self-antigens. And if you see neutrophils, this does not mean that there is bacterial translocation or there is a need for antimicrobial treatment. So diet should always be your first try. And similarly for eosinophils. So the lack of eosinophils does not indicate that this patient's not gonna respond to diet. Only half of the dogs with food responsive enteropathy had eosinophilic inflammation in the lamina propria. And they can be associated with different triggers, including allergic reaction, parasites. It's very common in pythium infection in endemic areas. And they use similar adhesion molecules by those used by neutrophils. So often we see both eosinophils and neutrophils together. So there was no evidence of bacterial overgrowth in the duodenum of dogs with antibiotic-responsive enteropathy. We know that the existence of this group is debated, and the higher bacterial abundance that we see in the ileum of these dogs with antibiotic-responsive enteropathy may indicate a more severe ongoing dysbiosis in this group as compared to the other ones. So attached bacteria does not mean that these are necessarily pathogenic. Here we have an image showing Enterococcus earae attached to the intestinal ileum of a healthy kitten, and this bacteria is believed to be protective from infection from E. coli in kittens. And invasive bacteria such as E. coli-associated granulomatous colitis, that's common in boxer and French bulldogs, are a real cause that should be treated with antibiotics. So this is a significant invasive bacterial infection, so different from our groups where we did not find evidence of invasive pathogenic bacteria. So there are some limitations, as you know. So the treatment response was determined by multiple clinicians. This was a retrospective study. Most of the dogs did not receive a second dietary trial. We know that many dogs can benefit from a second dietary trial and respond to that. The duodenum ileum was not available for all the cases. There was a single pathology evaluating the samples, as you know, that can have quite a lot of variability between observers. And we use formalin-fixed samples. And formalin is not the best preservative for the mucus where bacteria live, but there are many other previous studies that have used formalin-fixed samples. Next, please. So some conclusion. The inflammatory infiltrate and a number of attached bacteria or presence of attached bacteria should not be taken into consideration when guiding the treatment in patients with chronic enteropathy. There was no evidence of bacterial overgrowth in the duodenum of dogs with chronic enteropathy or antibiotic-responsive enteropathy. The higher mucosal abundance in the ileum of dogs with antibiotic-responsive enteropathy probably was associated with a more severe ongoing dysbiosis in this group, and dogs with food-responsive and immunosuppressive response showed more variability in mucosal bacterial abundance. So with that, I would like to thank all my collaborators, especially Dr. Cynthia Queiroz Machado. That's my master student that defended her thesis earlier this year, and this is the work of her master's. Thank you so much.